Chapter 9, Global Health. Before starting this presentation, I want to encourage you to take a few moments to consider what global health is and what role as nurses we might have in global health. Global health is defined by the Canadian Nurses Association as the optimal well-being of all humans from the individual and collective perspective. Global health encompasses prevention, treatment, and care while focusing on the improvement of health for all by achieving health equity. One aspect of global health is environmental sustainability. Environmental sustainability includes an intact and healthy ecosystem, and an ecosystem is defined as living and non-living organisms interacting with their physical environment. Disease can actually be prevented by healthy environments and ecosystems. And when we see these healthy environments disrupted, that's when we start to see things such as cholera, which is caused when sewage contaminates water, which is then ingested. There is an estimated 2.9 million cases and 95,000 deaths each year from cholera. Two aspects of environmental sustainability are One Health and planetary health. One Health is the interdependence of humans, plants, and animals, and planetary health is the health of humans and the state of the natural system in which it depends on. It is a field focused on characterizing the human health impacts of human-caused disruptions to Earth's natural systems. So an example of planetary health includes climate change. The concept of health equity is that all individuals should have a fair opportunity to attain their full health potential and that no one should be disadvantaged from achieving this potential. Some populations can have higher rates of cancer, while others might be more likely to be obese or use tobacco. These differences in health or medical conditions are called health disparities. A health disparity are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health. Examples of health disparities include race, gender, education, income, disability, geographical location, and sexual orientation. Health inequities are differences in health status or in the distribution of health resources between different population groups. And this rises from social conditions in which people are born, grow, live, work, and age in. As you can see, the social determinants of health play a very big role in creating health disparities and inequities, which in turn diminishes the attainment of health equity. Global burden of disease is a metric that quantifies the health of populations at regional or national levels. So examples of global burden of disease are morbidity and mortality rates. For example, hip fracture is one of the most serious consequences of falls in elderly, with a mortality of 10% at 1 month after the fall and at 30% at 1 year after a fall. There are many different global health issues, and this slide highlights a few of them. I'm not going to go into detail on this slide because we're going to do an activity in class, and you guys are going to help me define each of these global health issues. Global health nurses use interprofessional education, so understanding different health professions, collaboration between different health professions, and their understanding of global health to make major contributions in addressing the various health issues on a global scale. An international health nurse may work on a wide range of global health issues in a number of different settings. They may be employed by government agencies such as the United Nations, the World Health Organization, or non-government organizations. Many aspects of global health require us as nurses to understand the importance of culture. But understanding culture is also required in any day-to-day practice as a nurse, not only on a global scale. Culture is defined as shared patterns of learned values and behaviors that are transmitted over time, and they distinguish the members of one group from another. When we think of how culture might impact health and healthcare delivery, we have an example of maybe an immigrant to Canada. They're going to experience challenges within our healthcare system, and they might be related to language, education, previous experiences, money, age, and knowledge of the healthcare system itself. And this is going to impact the care we provide this patient. Canada prides itself on being a multicultural nation. And what that means is that we have multiple cultures coexisting within one place. And that creates cultural diversity. And it's brought through multiple mechanisms, but some of them are through immigration, refugees, and displaced persons. There's many different concepts that come with understanding culture, and so this slide has a bunch of different terms. The first one being ethnicity. And this is a group who shares a social and cultural history. So an example of an ethnicity might be Canadian. Subcultures are various ethnic, religious, and other groups with distinct characteristics. So an example of this within Canadian society might be a biker gang. Cultural pluralism is when smaller groups' unique culture identities are accepted within the dominant culture. So this is respecting other ways of life. So Canada is multicultural, and so that is an example of cultural pluralism. Cultural relativism is not judging a culture based on your own standards, but trying to understand that based on their cultural context. So for example, your culture might think eating fried crickets is disgusting. So if someone from a different culture offers you fried crickets, culture relativism would have you respond, "I don't eat crickets. Can you tell me why you like to eat them?" instead of, "Oh my gosh, that's disgusting." Enculturation is when individuals learn the norms and values of a culture unconsciously, whereas acculturation is the process of transforming cultural beliefs and values from your own culture and adopting traits of a different culture. And finally, assimilation is the process in which a minority group comes to resemble the society's majority group and assume the values, behaviors, and beliefs of another group, whether that be fully or partially. Cultural conflicts occur when there is a dislike, hostility, or struggle between two different communities who have different philosophies and ways of living. Cultural conflict is displayed through acts of ethnocentrism, such as stereotypes, discrimination, and racism. Essentially, it's you believing that your culture or way of life is better than others. Cultural imposition is a situation where one culture forces their values and beliefs onto another culture. As you can probably tell, cultural conflicts will impact the care a nurse provides to his or her patients. And this is why cultural competencies and cultural safety and humility exist. A cultural assessment is a systematic and comprehensive examination of the cultural care, values, beliefs, and practices of individuals, families, and communities. It's gathering of information that'll enable you as a nurse to provide culturally congruent care. Cultural competence is an ongoing process in which nurses continuously strive to work within a patient's cultural context. And essentially, as a nurse, you learn skills to interact with people from different cultures in respectful ways. Cultural awareness encourages self-awareness and self-reflection. So being aware of your biases that you might have towards other cultures. Cultural knowledge is acquiring an understanding of cultures other than your own. And cultural skills is an ability of a person to effectively interact, work, and develop meaningful relationships with people from various cultural backgrounds. Cultural encounters are interactions between groups or individuals across established cultural boundaries. And a cultural desire is a motivation and commitment to learn from others. Cultural safety is an outcome based on respectful engagement that recognizes and strives to address power imbalances which are inherent in our healthcare system. It results in an environment free of racism and discrimination, and people feel safe when receiving healthcare. We achieve cultural safety by developing cultural awareness, cultural sensitivity, and cultural humility. Cultural awareness is recognizing the differences and similarities that exist between cultures. Cultural sensitivity grows when we see the influence of our own culture and acknowledge biases. And cultural humility is a lifelong journey of self-evaluation, reflection, and learning, and allows for understanding and change. Finally, this slide here shows the steps to achieving cultural safety. And you can see it starts with cultural awareness, moving up to cultural sensitivity, and then up to finally cultural safety. One of the biggest things is that cultural safety takes a lot of courage and humility to achieve. This is a lifelong journey for us as nurses, but also as individuals.